All right, we are gonna go ahead and get started. It looks like we've got people who have gone ahead and entered. So hi, everybody. Thank you so much for joining us this afternoon. We're really excited to have you all here. My name is Paige Heitman. Welcome to the Scope at Night, a special edition of the Scope podcast. We're gonna go ahead and touch on a couple of housekeeping items before we get started. First, this Zoom session will be recorded. We would like to know who everyone is. So please just go ahead and ensure that your name is accurate. If you need help with this, please reach out to us using the chat box feature. I'll be moderating the session with my Phelps Health marketing colleague, Hillary McCash. So one of us will be sure to help you if you need it. It looks like she's already messaged good evening to everyone in the chat as well. So feel free to reply back to the Phelps Health marketing if and when you guys need anything. We would also love to see everyone's faces. It makes for a much more fun and interactive session. If you feel comfortable doing so, go ahead and share your video as well. Please note that each of you are currently muted. If you have a question that pertains to the topic being discussed, please add the question to the chat box and we'll try to get it answered. You can also add comments in the chat box. One thing to note about the chat box is that you can send questions and comments to the whole group or just one person. We'd encourage you to send your question or questions and comments to the whole group so that everyone can participate in the discussion. However, you're welcome to, oh, it looks like we have some people who are unmuted. I'm gonna go ahead and mute you. We encourage you to go ahead and send your question or questions and comments to the whole group so that everybody can participate in the discussion. However, you're welcome to send a private question or comment if you feel more comfortable doing that as well. We also want to encourage everyone to utilize the reactions that Zoom offers during this discussion today. You can use a hand clap, a thumbs up, a thumbs down to let us know if you like, love, agree, or disagree with whatever we're talking about today. Reactions can be found in two places, one either on the top or bottom of your screen, and one you'll see when you display the participant list. Also, if any of you are watching from our Facebook live stream, feel free to ask questions, comment, or show us emoticons during our conversation. We will be conducting a few polls, and we'll actually start with one today throughout this Zoom meeting. So you'll all get a chance to interact then, and if you choose, of course, remember the chat feature. Some of you may be using a mobile device, while others of you are using a laptop or maybe a computer. If you find that your features aren't the same, or maybe they're just not working like they should be, we just ask that you participate with us however you can. If you have issues with your sound, the Zoom meeting, or other features, please use the chat box and one of our moderators will be happy to assist. So before we begin today, I want to go ahead and introduce our panel members. So Dr. Forrest Rackham is a clinical psychologist at Phelps Health. If you want to go ahead and wave, Dr. Rackham. And then Jason Medows is a pharmacist at Phelps Health. So we have two of my very favorite people on our show tonight. I'm really, really excited to dive right in and learn from them and kind of see what they have to say about our topic of stress management. So welcome to our show today, guys. I don't know that we've ever had you on a Scope at Night live edition.
No,
I don't think so.
Yeah, it'll be a great learning experience for all of us, right?
Mm-hmm.
Very cool. So we're going to go ahead and start off with polling question number one. How often would you say that you experience stress? And all of these questions are anonymous, so answer as freely as you would like. I'm going to give everybody about 15, 20 more seconds to answer this. About 5 more seconds. All righty. And I'm going to go ahead and share those results. And this is probably not surprising to Jason or Dr. Rackham. A lot of those people fall within sometimes, often, or always. You know, I always say if there's somebody that never experiences stress, I would love to meet them and learn what their secret is. Because, you know, I feel like stress is part of everyday life, right? So I'm going to go ahead and stop sharing, and we are going to dive right into our question. Dr. Rackham, I'm going to throw this first one to you. What is stress? How do we define it?
Stress is something that's both physical and emotional. It has both of those components. Physical in that it affects us physically, usually with a release of hormones in our body. It also, we are likely to tense up our body in response to it. But stress is also anything with which we find difficult to deal with, and that we do not have the resources to meet the challenges of that moment.
Great, thank you. Jason, I want to give you an opportunity to, from your frame of reference, what does stress mean for you? Because you also have this really cool podcast outside of the hospital and outside your world as a pharmacist, where you kind of talk about stress from a rural perspective, from a farming perspective. So what does stress mean to you?
Stress, there's so many, and I think there's so many people like me that sometimes I think a good maybe synonym for stress is overwhelm. We get to do so many things, we're so many things on our plate, and then we find that we don't have necessarily all time for the things that we commit to, and that causes some sort of it's kind of like a defense mechanism in a way, and we are realizing that we are uncomfortable, and then it manifests in a number of different ways, and that's why I define stress.
Great, I love that. I also really resonate with that as well. Whenever you said overwhelmed, I was like, hit the nail on the head. Question number 2, what causes stress? Whoever would like to start with this one, I might have both of you go ahead and answer this question.
I think if it's okay, Forrest, I'll go ahead.
No, you're good.
I think it's different for everyone, right? What causes me stress may not cause Paige and Dr. Rackham stress, right? And vice versa. It's something that, like I said earlier, there's some sort of something that, and we may not even know what's going on, right? There's some sort of negative stimuli that has us bothered in some way. And a lot of times I think the stress comes up when we kind of push that away and don't deal with those things that are causing those negative emotions for us.
Mm-hmm.
Yeah, I would agree with you. I was just thinking about Kelly McGonigal's talk on TED that is a good one for many people to watch, which is how to make stress your friend, and what she emphasizes there is often that what we define as stress is largely up to our perception. Mm-hmm. And how we think about stress also affects then the physical outcomes and emotional outcomes of what's going to happen in our life. And so if I were to look at something as a challenge, then I'm less likely to look at it as something that's going to harm me or something that's going to cause some problems for me. Instead, it will be just something that is there as part of my life, something that I can grow from. And so that's a good one to look at, but also, so stress is up to the eye of the beholder.
Mm-hmm.
Yeah, perception's reality, right?
Mm-hmm.
So moving right along, question number 3. Do we know if stress has increased in the US as a result of the pandemic? And, this one is kind of a softball question because I think we can all assume yes, because I think in all of our lives, stress has increased, right?
Yeah, go for it, Jason.
Well, I was just going to say, I don't have necessarily any empirical evidence, but I can definitely say from anecdotal evidence, just through the people I talk to on a day-to-day and through talking across the country on my podcast. Stress has definitely increased as a result of the pandemic because for obvious reasons, we're not, it's a change. There are significant changes going on, and we aren't necessarily conditioned to have things change as rapidly as they have. So whenever we have that change, yes, that is going to cause some stress.
Jason, you bring up a good point, which is that the continuous changes that have come up on a regular basis. And as I was looking at some of the things that are top things for stressors, and sometimes what I teach in Intro to Psychology is that the biggest thing that contributes to stress is change. If you look at any kind of life event, anything that changes your life is bound to be something that could be perceived as stressful. And one thing that Jason has emphasized really well is that with COVID-19, there has been so much change that has happened in a rather short amount of time. And then even in terms of disagreements about whether or not you should wear masks or whether or not you should wear masks, and then having that changing like views from different leaders of our world about that can cause stress, because then we're just like, well, is it this or is it not? Is it this or is it not? And so just the dynamics of it we have found that change has contributed to that stress. What we have also found is that COVID-19, a lot of people are seeking services a lot more than they have in the past, including some of our own employees here at Phelps Health are starting to seek services where they might not have sought services before. And as looking at different listservs and also looking at different research, it does indicate that there is what many people have referred to as the second wave. And I think we talked about that one time, Paige, you and I, about the second wave that would happen, the mental health wave that would come up because of the COVID-19. And the numbers are matching that. Stress is increasing because of COVID-19.
Mm-hmm. Yeah. And do you feel like we're in that wave right now?
Yes. Yes, we are.
So moving right along into that. So we know that we're stressed right now. What happens to our body during stress? Because it's not just an emotional response, right?
Yeah. There's lots of things. Jason, did you want to take this or did you want me to take?
You go ahead. I think this is good for you.
Right. So what we do know is that if you think about it, like our brain has an alarm bell that goes off. It's like an awareness bell, or it's here's a danger bell that goes off anytime we experience stress. And so anything that could be potentially dangerous to our body then says, ooh, that's a stress, that's a stress, that's a stress. And so what happens then is that the alarm bells go off in our brain, then it sends a cascade of different hormones that go on throughout your body that help prepare your body for life, for fight or flight, and causes us to get ready to move into action, move into or away from the thing that's causing us harm. And we then, as it goes throughout our body, then our heart rate increases, our muscles tense up, our lungs kind of pumping more oxygen going through it. Our veins are constricting. And so there's a lot of things that happen to us physically when we are experiencing stress. And then how we perceive that as stress. So when you exercise, those are the exact same things that your body goes through when you're exercising. And I know Jason exercises regularly, and so he feels his heart pumping. He feels all the blood vessels opening up and constricting, all those different things. And yet he doesn't view that as stressful. And so therefore his body also is releasing other things to help out with it. So that's still stressful on his body. And yet there are different things that we can do. And I think we're going to get into that later on that will help out with some of the stress. So sorry, long-winded, but that's the physical components of stress.
Well, I know from like a personal point of view and from talking to others, I think we'll find through this discussion here today that Forrest is going to give you a lot more of the empirical studied evidence, and I'm going to give you more of anecdotal real life experience just from just because due to the nature of what him and I do. And from what I've found out and know from personal experience is everybody feels stress in a different place. For me, it's in right here, it's in my throat. I feel that tightening whenever I know that's whenever I am in a stressful situation. Some people it's their back, some people it's their neck. And I think what's really important is for each one of us to recognize where that is for us.
Yeah, I totally agree with you. It's funny listening to you say that yours is in your chest. Whenever I'm really stressed, mine is in my neck and my upper back. So you're right. It's totally different for everybody. I also sit in a chair, 8 out of 10 hours of the day. So that could be part of the stress too. So moving right along to question number 5, how much stress is too much?
The simplest answer that I can give is how much stress is too much is whenever you do not have the capability of meeting the stressful situation. So if you have a lack of emotional or mental or physical resources to meet the stress situation, that's how much is too much stress. And so it can vary. It can vary based upon, sometimes you will be able to handle the stressors because you have all the capabilities and all the coping strategies that you need at that time. And then other times that same amount of coping strategies that you have are not going to match up.
Yeah, Jason, I want to ask you this question too, because you and your family, you guys run a family farm. You're really heavily involved in agriculture. That's a lot of the population in this area. So how much stress is too much for families who are really heavily involved in agriculture? Because I kind of sometimes feel like the mindset is, well, you just go and you go and you go and you shove it down and you just don't ever deal with it.
Yeah, I mean, that's $1 million question, right? How much is too much? And I don't know if there's necessarily a clear-cut black and white answer to this. And again, just like stress, just like some of the answers to the earlier questions, it really depends. It depends on what season of life you're in. It depends on how good your mental health is at any certain point. I know for me, now that I'm in a much stronger place mentally, I can handle a lot more stress than I could have, let's say, 5 years ago when my mental health wasn't as good. So, I mean, it's really is individual. I think it's up to a person to become very self-aware as to how much their body can handle. And again, when we're talking to a lot of the population, I think that's easier said than done because really getting to know your body is difficult for people. But I think that's the key answer here, is to really understand yourself.
Yeah, that's a great answer. Thank you so much for sharing. So question number 6, what's the difference between acute and chronic stress? And what are some examples of routine stress that people might experience?
To answer that question, difference between acute is something that happens in a short duration of time, something that you experience one-off and it's done. A chronic stress is something that you have to deal with on an everyday or regular basis, that it's difficult to shake. And so some examples of routine stress could be back in the day when I used to work at a supermarket. It was just hearing the bell go off over and over and over and over again every time I had to pass the groceries over the line. And after a while, I started carrying that into my sleep. And so it was, after a while, that monotonous sound became stressful. But other routine stressors could be that someone cuts you off in the parking lot. We have found another routine stressor is what we carry in our pocket. We have found that when people carry their phone around in their pocket, anxiety increases, stress increases. And it's just because we get more of those notifications. Because we get more of those notifications, our mind goes there. And so that's a regular everyday stress that still affects our bodies, still affects our mind, and still affects our emotionality.
Mm-hmm.
Paige, not to hijack your job here as far as being the host, but I want to ask Forrest a question. With technology being rapidly evolving so fast, are we capable as human beings in keeping up with that, evolving with it? Is technology, I guess the simpler question is technology evolving faster than we can naturally?
So what I've read so far is that, yes, technology is evolving faster than we have adequately made enough coping resources for it. But that's at least what I've read so far. From my own opinion, I would say that, yes, it's evolving so much so that's sometimes why we just need to take breaks from technology in general. And I think I've seen you take breaks every once in a while from, even though you're doing podcasts and you're quite vocal on social media and stuff like that, I've seen you take breaks from social media or just from technology in general, and take a vacation or something like that. And so that is, yeah, because it's evolving so fast, I think that sometimes we just need to take a break from it so that we can reorganize our mind and life for it.
Yeah, I mean, I totally I totally agree with that, because it is. I mean, it just, things have happened, especially since the last 10 years or so. I just think that society, how easy things are becoming to access. I think that does give us a lot of stress when something, even when something very acute, like we were saying, comes up and we are inconvenienced. It seems like we're having a harder time dealing with that now, which, those acute stresses sometimes can compound into chronic stress. So yeah, it's a really, I think it's a really fascinating thing to kind of explore, and to see what the kind of stresses that technology has put on us as a society.
I'm in agreement with you. One thing that I remember is we went to church. Jason and I go to the same church. When we were at church, one of our friends had also mentioned how even work from home has become like a constant stressor for them, because he gets out of bed, takes a shower, sure, walks his dog, but then goes right to work. And because he has that work environment, which is his home, he's not able to take a break. And what we've found also is that when people do work from home, they have to have a clear delineation of home and work. And that really helps them to be able to separate in their mind the different stressors at work, so they don't have to take it home. But if you're doing it from home, those stressors are there with you regardless.
Mm-hmm. Or whenever you work in marketing and everything that you touch and do is is that world, right? I noticed that Jason takes breaks on social media. One of the things that I try to do too is after a certain time during the night, I don't touch my phone, because I noticed that I sleep better if I don't touch my phone like an hour before I go to bed. I try not to get on it before I come to work, because whenever I come to work until the time I leave, I'm on my phone, or I'm calling people, or I'm looking at social media, because that's just the nature of the work that we do. Yeah,
so sorry, didn't mean to break in, but not to stay on technology too much, but something I did for a while, I've quit doing it, and I don't know why. But something I did for a while is I quit using my phone as my alarm. Okay. I used, I think most people use their phone as their wake up alarm in the morning, just because it's so convenient, so natural. But I found when I was using my phone as my alarm, I would turn off my alarm, then I'd go get on social media, or I'd check email, or, looking for something to react to. Right. And I found pretty soon that was like giving me stress to start the day. So there for a while, I just totally shut my phone off before I went to bed, just turned it off. And I have a smartwatch, and I used that as my alarm. Having this conversation makes me realize I should probably start doing that again. But I think that's really helped me out there for a while, because I wasn't going straight to my phone first thing in the morning. It was becoming such a habit, and I was reacting to things, as soon as I woke up, and I wasn't having any time to just kind of wake up. So I think that was a really something I did that really helped out.
Yeah, I think that's awesome. That might be something I need to implement. Thanks for sharing. So tonight, if anybody messages me, I turn my phone off because Jason told me I should.
Right, exactly.
So before we hop into our next question, I'm going to pop up another polling question for everybody. Do you turn to unhealthy food indulgences, such as eating junk food, drinking excessively, or eating sugary foods or sweets when feeling overwhelmed? And again, these are completely anonymous, so feel free to answer honestly. If you feel uncomfortable answering, you also don't have to answer. Give everybody about 5 more seconds.
It's good that you ask these questions, because I'm asking myself these questions. I'm like, goodness, I need to change some behaviors.
Right. I do the same thing. Sometimes whenever I'm overwhelmed, or even I used to do this whenever I was celebrating something, I would go and buy a snack, or we would go out to eat, and we don't do that anymore, because I shouldn't be motivated by food for things that I do. Right. So now I go and I go on a walk, or I'll buy my dogs a new toy, or whatever it is. So it looks like a majority of the people sometimes, often, or always indulge in these types of behaviors whenever you're feeling overwhelmed or maybe stressed. I know that's kind of how we define stress as being overwhelmed. So this is perfect. We're so glad that you guys are here to continue having this conversation with us. So just diving right into question 7, what happens if we don't do anything about our stress? Besides me eating chocolate, right?
Well, I always compare it to to a log sitting on top of some water, and you push that log down underneath the water. That's like pushing our stress down. Well, the further and further and further and further you push that log down underneath the water, the harder it is to keep it contained, the harder it is to keep it under control, until soon it's just going to shoot back up to the surface. And the further you push it down, the more explosive and bigger waves it's going to cause coming back up to the surface. And I find that is very comparable to how we if we don't do anything about our stress, if we keep pushing that stress down deeper and deeper and deeper and don't do anything about it, it's going to just, one of these days, you're not going to have any control over it, and it's just going to come out like a volcano.
Mm-hmm.
Yeah, I second that. That's a great analogy. I always use the beach ball underneath the water. And it shoots. I love the analogy of the log. But yeah, and it comes out in different explosive ways, right? It comes out like sometimes I'm short with my spouse or with my kids, or maybe I just get more irritable and angry about having to do paperwork or some other things that just I've been pushing down and pushing down and pushing down. So it can affect relationship. It can affect even how we sleep. It can affect, it comes up because now I have more worries at nighttime. All those worries I've been pushing down and stress that I've been trying to push away, all of a sudden it's coming up and manifesting in my dreams. And it can come up in our bodies. So oftentimes emotionally and physically, we feel drained, or we also feel as if no one understands us, no one cares. Yeah. And it kind of makes it so that cognitively or in our thoughts, we start narrowing our focus to the point where it's like, well, no one understands me. If other people understood me, then they would let me go. They would help me out. And we start to isolate ourselves, at least in our minds, more because we're thinking we're the only ones that are experiencing this kind of stress.
Yeah, I found out, that when you keep all that stuff to yourself, you do tend to isolate more, and you do feel like you're the only one type thing. And I've also found that if you do talk to somebody about it, it's like such a relief to know that you're not just the only one, or not even that you're not the only one, but these are things that you can actually vocalize. I think that's almost as therapeutic as actually doing something about it, is just letting somebody know.
Yeah, definitely. So letting someone know, and if you don't, so emphasizing a little bit more, we found that stress is related to hypertension. It's related to weight gain. It's related to depression, anxiety. It's related to social isolation. It's related to a lot of other problems, and also skin problems. Some people get rashes because of that. Mm-hmm. Yeah, sometimes you'll be amazed. I'm pretty sure Jason has experienced that, but as you do talk to someone, all of a sudden sometimes for me, it's like I'm sitting here with my shoulders up in my next to my ears, and I feel like I'm turtling it and everything like that. And after I share something with someone, I'm just like, my shoulders are down and my heart is slowed down, and I feel like I can walk a little bit more freely. And I'm like, wow, I'm glad I talked to someone about that. Why did I go along?
I love that. Very cool. We're going to skip right over this since we already did our polling question. Question number 8, and I love asking this: is stress ever good, useful, or necessary? Because we've kind of talked about all of the negative implications of stress. Is there anything good that ever comes from stress?
I think stress is necessary. I think it's very useful because it does, it's a natural reaction to something that needs to be tended to. So you know that something is going on if you're stressed or feeling anxiety about something. I read a book by, Redefining Anxiety was the name of the book, and John Delony is the author. He actually works for Dave Ramsey's team. And Forrest, are you familiar with him?
I'm not, no.
You're not? Okay.
Yeah.
But it's just, that's what the whole book is about, is, we have this such negative connotation around anxiety and stress, like, oh, we want to avoid stress at all costs. No, stress can be a very, very useful tool. And it's usually a very important signal that we need to recognize. Where the problem comes in is when we don't do anything about that stress and we let it go unchecked. Then it becomes like that log that we're pushing down in the water.
So if you could simplify it, it would be just, is the stress helpful or unhelpful? And then if we go from there, is it helpful or unhelpful? And you also, what I heard you say is that it's kind of a messenger. It lets you know, it informs your life, because you might be stressed because you want to take care of your child. Right. And so that might inform you and let you know that, hey, my family's important to me. And that's why him being sick or her being sick, that's why it's important for me to check in on them. But that's still stress.
Mm-hmm. Mm-hmm. Absolutely.
Yeah, I love that. What a great way to define that. And I totally agree. Sometimes stress is necessary, right? I'll give a great example. I recently stepped into a new director role, and I have been in this role for, I think, 3.5 weeks now. And I feel like, yeah, I'm under a little bit of stress, but it's absolutely necessary in order for me to grow outside of my comfort zone, right? So I recognize that, and I make probably 5 lists a day, and we work through it. So moving right along, question number 9. What are some positive ways that people deal with stress? So for me, lists, absolutely.
So I had a friend reach out to me this week. He's a very, very good friend. He talked about, he is kind of in a similar situation to you, Paige, and he is a new business owner. And he was talking about how, man, I need to make more calls a day. I need to make more sales calls a day. And, he was stressed. I said, I need to be making 15 sales calls a day. But now I'm like only making 5 because it causes me such stress to do that. And he's like, I feel like I'm failing because I'm not making those 10 to 15. I said, okay, what if you made 6 calls a day this week, and then incrementally increase that. And then here you go, in 2 months' time, you're going to be making those 15 calls because you made those little tiny changes every day. And it reminds me of the book, and I actually recommended this book to him called Atomic Habits by James Clear, where you can make little tiny small changes, atomic changes at the atomic level every single day. And those will eventually stack up and compound into amazing changes in a relatively short time.
Yeah, I'm agreeing with you. That's when I visit with patients. It's always about the small things. And so some patients will be like, that's all you want me to do? You want me to say hi to my neighbor? And as we've talked about it, I'm like, well, do you talk to anybody else now? And as we talk about some of those small incremental changes, then it's synchronicity. They're out saying hi to their neighbor, and then someone walks by and says, oh, hi, Joe, how you doing? And you're like, oh, hi. And then someone else is talking to you, and before you know it, it starts to become a habit and moves forward. And also, right there with you, Jason, as it emphasizes in that book, is that as you make those small changes, those are small changes that can be manageable. Those are small changes that are doable and can be longer lasting, because it's not a big new project. It's not a big new program. It's just making those small changes.
Yeah, I love that. That's really great. Question number 10. We talked about making, these small incremental changes. What about exercise? How effective is exercise in reducing stress? I see Dr. Rackham smiling.
I'm smiling partially because I remember, I think it was about, was it almost 2 years ago, Jason, that you and I were meeting together at, like, I don't know, maybe Labor Day weekend, or it was the 4th of July. And we were having a picnic with a whole bunch of other people. And he was telling me
Easter.
It was Easter. There we go. Easter. And that's when you had said, I think I'm going to start running. And you were kind of nervous about that. And can you share us a little bit of your experience of how exercising by running had helped you out with reducing stress?
Yeah, I mean, and I say this to everybody that asks me about stress management, and I tell them that exercise is the number one thing that I have done to help lower my stress level. And I think, and I know there's clinical evidence about it, and I'm horrible with clinical evidence. I don't know if that just speaks to the type of person I am, but I know that it's just been so like helpful to me to just get out and get away from people and clear my mind. And when you're doing, it's like Forrest was saying, all those things that are causing stress, those are things that you're doing when you're working your body. But I think, and I've never thought of it this way until just now, well, maybe you're conditioning yourself a little bit to those stressful times. Maybe your body is more used to feeling that way and can handle stress because it's being trained that way. I know the stimuli are different, but still a lot of the physical signs are, increased heart rate, increased respiration rate. All those things are very similar to what's happening when you're under a lot of stress. So I think I think your body is, whenever you're exercising, you're becoming conditioned to that.
I would echo that. It's almost like, I didn't think about it until you had to share that, but it's almost like an inoculation.
Yeah, exactly.
That stress by doing little bits of stressful things at a time. So I think that's great. It's just funny because I've watched Jason. He's gone on his own journey and everything like that. And I've just watched as he's incorporated exercise, and I'm speaking for you, sorry, incorporating exercise almost to a point where it's like, it's not a question of whether or not I have to do this. And he seems like he's priority of it to say, no, I'm going to make sure I go to bed this time so I can actually get up at time, so I can actually exercise and do it the way I want to do it.
Yeah, 100%. No, you hit the nail on the head.
Yeah. And so exercise is a great thing. For me, my experience has been that when I've exercised, and I was going to exercise a little bit this morning, so I can say that I started exercising, but when I exercise regularly, I find for me, I feel endorphins. I feel like I get that runner's high, and I'm just enjoying it throughout the day. And it helps me keep more focused. It helps me be able to take on more of the challenges throughout the day. And so research has also indicated that it doesn't matter really what kind of stress you are, what kind of exercise you are doing, just as long as it's exercise that you will do.
Yeah.
And it doesn't matter when you do your exercise. It just matters when you do it. So you can do it at any other time. Just do it whenever you can do it.
Mm-hmm. Yeah, make it work for you, right? You don't have to follow what everybody else is doing. You can follow your own thing. Yeah, very cool. We're going to skip over number 11 since we've already kind of answered that question over the last two questions. Question number 12 is one of my favorite questions as well, because I'm naturally pretty introverted. So how do introverts relieve stress? Because I think sometimes the perception is that with people who are more extroverted, my husband's more extroverted, the belief is that, well, you'll feel better if you get around people, right? That's not always true for everybody. So what does that look like? Whoever wants to take that one on first.
So I am like your husband, and I have no personal perspective on this because I am a natural extrovert, and I deal with so many things I do. It serves me really well. My wife is a very natural introvert. She likes her time alone, and sometimes it does. It's like, how do you do that? But for her, it is every single night, and I'm speaking for her here, but we've been married for enough time where I can do that now. Every single night she goes and it's hilarious because she announces it to the house that it's relaxation nation time, that she's going to go, she's going to sit down, she's going to read a book, and she is not going to talk to any one of us. Because, you know, at our house, it's myself and our 4 sons, and it's kind of like a fraternity house. I mean, it's just constant chaos around here, and she needs to remove herself from that for a period of time before she goes to bed. And taking that time, and then I'll go, and she does it on the front end as well. She gets up early in the morning and takes that time to herself. So as you were saying, Paige, like, some people say they need to be around people. Well, I think for introverts, it's the opposite is true, is they need to take some time to be by themselves and do some things away from people.
Mm-hmm.
Yeah. Research has indicated that introverts often experience things much more intensely than extroverts. And so they're receiving much more information from all the different sensations and all those different things. And it doesn't take much to excite them. And so therefore that can be overwhelming and it can drain their resources. And so oftentimes introverts find solace and solitary activities as something that rejuvenates their batteries or recharges their batteries. And just like you, Jason, I'm the kind of guy where I like being around people, and I like enjoying their presence, and that charges me up to a point where I feel like I'm kind of shaking at the very end of the day if I have too much activity, just because I've gotten juiced up on it or something.
Yeah,
But,
I agree. I know the feeling. Yeah.
Yeah. And so it's introverts, solitary activities, just like Jason had indicated.
Yeah, so if we have any other introverts on here, I hear you, I empathize with you. I have this thing, all my friends joke about it. It's called Paige's social meter. So, you know, throughout the course of the day, or whenever we go to an event, people will always be able to tell whenever my social meter has run out, because like right now I'm bubbly, I'm having fun, but if I get to a point where I'm exhausted, I'll just shut down and I won't talk and I'll be tired. And it's not because of anything anyone has done. It's just my social meter ran out. So for all of our extroverts on here, I hear you. So moving right along, are some people more prone to stress than others? And this might have a lot to do with introverts versus extroverts.
I don't know that answer, to be honest. As we're prepping for this and stuff, I was looking around, and I don't know if there is a clear-cut answer for that in terms of how some people are more prone to it. We do know that early childhood experiences, such as trauma and other things or neglect, could potentially lead to people having be more prone to stress. But then you have some people that are quite resilient and who have experienced trauma in their life and have been able to bounce back pretty well. I don't know if there is a clear-cut answer for that at the moment. Maybe that's something to research a little bit more. Jason?
No, I'm with you. I don't know. I'd like to have an intelligent answer. I just don't have one.
You know, sometimes that is a great answer, though, is we don't know. We just need to wait and we need more information, right?
Yeah.
So moving right along, there are some of these questions that we've already kind of answered over the course of, you know, the last 45 minutes we've been talking. So I'm just going to breeze right through some of these and we'll just move right along to question number 17, because I want to make sure we get through the meat of the questions. What do we mean when we talk about mental health?
That's a good question. I think Jason and I have both, when we've talked to you on like a radio show or whatever, we've tried to redefine it as behavioral health, often because mental health has that negative connotation to it. But when we talk about behavioral health, it's anything that affects us emotionally or our thoughts, cognitively, or even relationally with other people. And that's usually what we mean by behavioral health.
Yeah, anything to add to that, Jason?
Yeah, well, I mean, so whenever I started my podcast and started this journey, I expected to talk more about what we now understand to be like mental illness, talking about depression, anxiety, and then things down the line there. But what I found out really quickly is that we all have mental health. Every single person has mental health, and it should be treated as such. I mean, do only people who have coronary artery disease get their blood pressure checked at the doctor? No, everybody does. And I think that's kind of the same way we need to start seeing behavioral health, is that we all have it, and it's kind of on a spectrum where we can ebb and flow, and we need to do things that pay attention to it, to be proactive about it instead of reactive. And I think that's part of kind of changing the stigma around it, is to help everybody understand that it's not a negative thing. It's just it's a totally neutral thing that we all have to pay attention to.
Well said.
Yeah, yep, that's exactly what I was going to say. So I will echo Dr. Rackham. Question number 18, when should someone seek out a clinical psychologist, a psychiatrist, or a counselor for stress that they're experiencing? So what's the threshold for seeking help or seeking somebody just to talk to?
I don't know if there is a threshold, to be honest, because sometimes it's good if someone's having a hard time, just say, hey, I need someone to talk to, or hey, I'm running out of ideas. I don't know how I can handle this, or hey, I just need better sleep. Can you help me out? So there shouldn't be a threshold, but oftentimes people will say, well, I have to be really bad in order to see a psychologist or psychiatrist or a counselor. But that's just not the case. You can see them for improving life. Nowadays, some people because they don't want to visit with a behavioral health counselor or something like that, they might call up their life coach. And yet the life coach would probably help them out in very similar ways that a psychologist or a counselor would, in terms of helping them improve their health overall.
Yeah, and again, it goes back to what the stigma is surrounding this topic. And we always see as like a counselor, a psychiatrist, a psychologist, as something that has to happen like as a last resort, right? That's a way that it's always traditionally been seen. But I think if you'll talk to Forrest and you'll talk to a number of other behavioral health providers, they'll say, no, come sooner. We can be very, very effective at being proactive instead of reactive. Like I was saying earlier, I mean, we can get out in front of these things with the help of someone, of a professional, and it doesn't have to get so bad before you come see somebody. In fact, it makes things much, much easier to manage if you don't wait till it gets bad. So like Forrest was saying, I don't know if there is a threshold.
Yeah, I think that's amazing. I love that. I'm a huge proponent of going and talking to somebody just to have a conversation, because a lot of times I think we don't realize how important behavioral health is until we start talking to somebody else, right? Because our family or friends are always going to be biased because they care about us and they love us and they want to see us be successful. But it's really important to talk to somebody that has an unbiased view about your life.
Yeah,
for sure.
So moving right along to question number 19, what if someone doesn't feel comfortable talking with someone about their stress? So what if somebody comes into your office, Dr. Rackham, or somebody's talking to you, Jason, and you can tell that they don't really feel comfortable opening up all the way? Do you still talk with them? What are their options? What are some conversations you might have?
For me, I just start talking about stress, to be honest. Like, what is it that you say you don't want to talk about stress, but what is it that you don't want to talk about stress? And just take people where they're willing to come in at, and meet them where they're at, and then go from there. And if they don't want to talk about it, that's fine. At least they got the sense that you're welcoming, you're open to them, and you're willing to listen to them whenever they do feel like they want to dive a little bit deeper. And some people, that might be just enough for them, and they're like, okay, I talked about stress, and that's it for right now. That's good. And that's okay. Let them take a break. Let them come back to it if they want to, if they need to.
So to add to that, there are a lot of non-threatening ways that people can not necessarily talk, but like experience the feelings that go along with talking about that. And obviously my podcast and other podcasts like it, I don't want to just pigeonhole it to me. That's a really safe way for people to kind of get introduced. And I've said that often, like, I don't necessarily want to be the end part of somebody's journey, but I do take a lot of pride in being the beginning here's the first step, and the thing about listening or whatever is nobody has to know that you're listening to that. It can be a totally personalized thing that nobody has to know about. And if you don't feel comfortable around anybody else, you can at least maybe feel comfortable with yourself. And again, that's part of the journey as well, is, that self-actualization. But I think that's a really good point. Books, magazines, blogs, that sort of thing. There are other nonverbal ways to experience that than just talking to someone.
Yeah, I'm in agreement with that. Yeah. You brought up a lot of good ideas because I didn't think about it. But yeah, one of those ways, if they feel comfortable talking with someone else about stress, it could be that they don't have to talk, like you were indicating. They can read, they can get a podcast, they can also text someone. They also have the crisis text line. And I was just someone recently who has been trained in the crisis text line, and she was indicating, yeah, you can talk to us about how bad your day is. You can just shoot us a text indicating that you're really struggling to get out of bed, or that you anything, she said. And so sometimes texting and sometimes meditation. I'm a big fan of that one as well.
Yeah, very cool. Lots of options for all different types of comfort levels. So question number 20, what's the best way to communicate with others about stress? What types of conversations should we be having?
Well, I'm a big proponent of just making it a point to check on people. I have a new rule that of myself, like if somebody pops into my head randomly, I don't think it's necessarily random, even if it seems to be. I feel like that I am called to talk to that person or reach out to that person. If a person pops in my head, I make it a point to send them a text or send them a message or give them a call sometimes, depending on who the person is, and just make it a habit of that. If I can do that one little part as me, maybe that will pass on down the line to some other people.
Yeah. Other things that come into my mind is when you're talking to other people, just sometimes sharing some of your stressors. And then, because then people are like, oh, so you do have problems and struggles. That's awesome. I was going to say you have sucky moments. But yeah, yeah, I have sucky moments, and it really stinks sometimes. And so being able to say something like that, then also good, because I do too.
Yeah, I want to hop right on to our last question, because we're kind of talking about that right now. How can we help someone who is feeling stressed, right? Because you had mentioned that, hey, this sucks. Do we ever want to tell somebody, I'm so sorry, or it's going to get better, you're going to be okay? What are like some key phrases when we can tell somebody's really going through stuff, they're going through a tough season of life? What are some words or phrases we can use to encourage them, and words and phrases that maybe we should refrain from?
So again, I go back, I have this kind of new thing that I've done from people, because sometimes people do want actual advice, but sometimes they just want someone to offload on. And before I reach to because I want to, my tendency is to want to fix things, right? But now I'm trying to fight that tendency in saying, okay, do you want advice, or do you just want someone to talk to? Do you want someone just to vent to? And then that way, I think you can become a much more intentional listener. And that's what I always, I am very, I admire about Forrest, is he's such a good listener. He's so good at, repeating whatever I've told, and to make sure you and him are on the same page. And I think that's obviously due to his training and to his profession, but also due to his personality. I think I admire that about you. And I'm trying to emulate that a little bit, and trying to, understand, what does that other person need?
Yeah. I couldn't have said it better, Jason. I agree.
You're doing a great job, Dr. Rackham. We all love you. No, I think that's awesome. So we're actually at the point of wrapping up. We've only got 5 minutes left, so you guys did a really wonderful job. I know I learned a lot from you. Hillary has gone throughout the course of today's webinar and shared all of those links, all of those books that Jason and Dr. Rackham have talked about today. So feel free to utilize those sources to learn more about behavioral health. Go ahead and click that link to learn more. But thank you so much for tuning into the Scope at Night, everybody. We really appreciate all of you. A huge thank you to our panel members, Dr. Rackham and Jason. Again, you guys are always a huge wealth of knowledge. We always learn so much from both of you.
Thank you very much.
Thanks for having me.
And will you provide those resources for those people that are not involved in the chat? Will you provide those resources?
Yeah, absolutely. We totally will. We'll share those in the follow-up too. So as a reminder, the show has been recorded and it will be emailed to all of our participants, and we'll include all of those other links as well. It can also be rewatched on our Facebook page. So if you guys want to go share it, feel free to do that with any friends or family who may have missed the show. If you like the show and want to know more, go ahead and check out our other episodes of The Scope on phelpshealth.org. Thank you so much, everybody. Have a great rest of your evening.
Thank you.
Thanks.